What's up, guys? Today we're going to talk about the cardiovascular system. Let's start off with some terms you might have heard before in the past. Let's talk about a little pathology. So, one disease you might have heard of before is high blood pressure, otherwise known as hypertension. Another one might be a heart murmur. Another one you've definitely heard of is a heart attack or a myocardial infarction. Or how about congestive heart failure? These are four pretty well-known disorders of the cardiovascular system. But before we get there, let's talk about the normal anatomy of the heart. Today, we're going to focus on the blood flow through the heart. I'm going to start by giving you a drawing of the heart. Let's begin. All right, so here we have great drawing of the heart. Let's start with the four chambers of the heart. We're going to start with the right atrium and the right ventricle. The right atrium is right here, and the right ventricle is right here. Now, let's do the left atrium and the left ventricle. The left atrium is right here, and the left ventricle is right there. So, we have the basics down. We have the four chambers of the heart, which are the two atria on top and the two ventricles below it. Now, we're going to discuss how blood flows through this heart, because it's very important. Now, because it's cyclical, there really isn't a starting place. But normally when we discuss this, we talk about the beginning being this chamber here, which was the right atrium. So blood is going to come from the body to the right atrium through these two vessels. And these two vessels are known as the superior and inferior vena cava. So we'll call that number one. The superior and inferior vena cava will bring blood to the right atrium. So the right atrium will be number two. Now, this right atrium contracts. And where is it going to push that blood? It's going to push that blood into the right ventricle. It has to pass this valve right here, and this valve is known as the tricuspid valve. We pass through this tricuspid valve, which is a one-way valve. It opens up to allow blood to go down, but ideally blood would not be able to go the other way, which is why it's a valve. So that tricuspid valve separates the right atrium from the right ventricle. Now we have entered the right ventricle. The ventricles are more muscular than the atria. If you can see, there's this area here, which is representing myocardium. That is heart muscle in Latin. One interesting fact, Notice that the right ventricle myocardium is thinner than the left ventricle myocardium. That'll be important later. This right ventricle will then contract with that strong myocardium. Where is blood going to go? Well, because this tricuspid valve is one way, blood will not go up that way. It's going to pass through this valve and enter into this vessel. The valve it's going to pass right here is known as the pulmonary semilunar valve. And as it passes the pulmonary semilunar valve, it will enter the pulmonary trunk. This pulmonary trunk will split into left and right pulmonary arteries. What does pulmonary mean? Pulmonary in Latin is referring to the lungs. So anytime you hear the word pulmonary, I want you to think lungs, like pulmonary embolism, right? That is a blood clot in the lungs. So the pulmonary trunk and pulmonary arteries here are delivering blood to the lungs. Now let's take a step back. Why are we delivering blood to the lungs? Well, what do the lungs do? They breathe in air, and a certain percentage of that air has oxygen that we need, right? Because oxygen is what we use to create energy inside of all of our cells. So we are sending blood to the pulmonary arteries, then to the lungs to pick up oxygen. Those lungs, through breathing, will pick up that oxygen. We also drop off carbon dioxide, which we end up exhaling. But we've picked up oxygen in that blood, and now that blood is oxygenated. It is freshly oxygenated blood, and that oxygen can now be used to deliver to all the tissues of the body. So, how do we get that blood back from the lungs to the heart? Because we haven't talked about this entire side of the heart, this entire left side, right? So we need to bring that oxygenated blood back to the heart. And the way we do that is through the pulmonary veins. This right here is the left pulmonary vein. There's also one hidden that you can't see because of these vessels, the right pulmonary vein. The left and right pulmonary veins will deliver blood to this chamber. And what was the name of this chamber? The left atrium. So that left atrium there receives blood freshly oxygenated from the lungs. And it kind of repeats itself. Just like this atrium on this side was sending blood to this ventricle, this left atrium will send the blood to the left ventricle. And it does pass another valve here. This valve is called the mitral or bicuspid valve. From that left atrium, we pass that mitral valve and end up in the left ventricle. That left ventricle is the strongest ventricle in the body. It has the thickest myocardium. And you tell me, why does this left ventricle need to be the strongest? Well, what have we not done yet? We haven't sent blood to the whole body. This left ventricle is responsible for sending blood to the whole body, and therefore it needs the thickest and strongest heart muscle or myocardium. When that left ventricle contracts, it will send blood up through this valve into this large artery that you see on top here. The name of this valve there is called the aortic semilunar valve, and the name of this largest artery in the body is the aorta. Where is that aorta delivering blood to? It is sending it to the entire body. So these 13 steps that you see here are the flow of blood through the heart. That's what normally should happen. It should start in this right atrium, go to the right ventricle, pump to the lungs for oxygenation. Once it's fully oxygenated and we've dumped off the carbon dioxide and exhaled that, then the oxygenated blood passes to the left atrium, then to the left ventricle, up to the aorta, and to the systemic circuit, or the entire body. That is normal anatomy. Now, let's talk about what can happen if things are a little abnormal. For example, hypertension. If you remember, we said at the beginning, hypertension was high blood pressure. Now, that doesn't really deal much with the heart, and it more so deals with the vessels, specifically the arteries. Hypertension is referring to when the arteries have a high pressure inside of them. Like this aorta right here. If it starts experiencing a high pressure from the inside of that blood pushing from the inside against the walls, that's called high blood pressure. Now, how do we measure high blood pressure? Usually you've seen it done here on the brachial artery, but ideally we would measure it on the aorta. We can't do that, so we take it here on the brachial artery, sometimes on the wrist. That can be due to genetics. It can be due to poor lifestyle. What ends up happening is these arteries, they lose their elasticity. They're not able to stretch as well. And so the pressure inside of them increases. And that can lead to things like coronary artery disease. Because the pressure is so high, the blood moves slowly, and there's more chances for plaques to develop. The next one is a heart murmur. You've probably heard of that before, but what is a heart murmur? Well, remember these valves we talked about? We learned about 4 valves, right? The tricuspid and bicuspid valves, as well as the pulmonary semilunar and aortic semilunar valve. Well, remember how those were one-way valves? They're not perfect. And sometimes if blood flows abnormally through them, or even flows backward through them, called regurgitation, that causes you to hear a sound when you're listening with your stethoscope, and that's called a heart murmur. Usually, heart murmurs are pretty innocent, and they don't really mean heart disease, but they are something to monitor and keep track of. The third one here is a myocardial infarction, and if you remember when we said at the beginning, myocardial infarction is the fancy term for heart attack. What is a heart attack? Well, as you could imagine, we're sending blood to the body to deliver that oxygen, right? Because we need to create energy. We need ATP. Well, guess what needs the most ATP? The heart itself. So there's a vascular system of the heart where it delivers blood to itself. And it's delivering that blood to this myocardium here. All of these muscle cells need freshly oxygenated blood. And if it doesn't get freshly oxygenated blood, then it starts to not produce ATP. And if it doesn't have that energy, that tissue can die. And that is known as a myocardial infarction, when the myocardium of the heart dies due to lack of oxygen. That is most commonly occurring on this left side here because that thick layer of myocardium requires the most oxygen. The last thing I want to talk about is congestive heart failure. What do we mean by congestive heart failure? Well, think about it in terms of traffic on the freeway. We talk about how the freeway is congested, lots of traffic moving slowly. Congestive heart failure can be divided into right-sided congestive heart failure and left-sided congestive heart failure. If blood is moving too slowly due to things like the heart muscle being weaker or less efficient and it's not pumping as much blood per beat, that lack of efficiency causes blood to back up. If it's not moving through these chambers as quickly, it starts to back up. So if it's getting stuck in these areas, it'll start to black up, causing congestion in these vena cavas, and then further down the line. And if you don't know, these vena cavas lead to the rest of the body. And if there's congestion in these vessels, there'll be congestion all above and below those vessels. And that's why right-sided congestive heart failure leads to swelling in the arms and especially in the ankles, because that congestion causes the blood to leak out of capillaries into the tissues, right? So we get this congestion and buildup of fluid in the body. So swelling in your tissues can be a sign of congestive heart failure. What if the congestive heart failure is on the left side of the heart? Well, if it's congested here and it's congested here, then it will get congested in these pulmonary veins. And if we follow those, where do those pulmonary veins lead to? They lead to the lungs. And you start getting congestion in your lungs. And that can lead to things like cough and shortness of breath, which is why sometimes heart disease leads to pulmonary symptoms. And it can lead to cough and shortness of breath, especially during activity. So it's really important that you monitor these symptoms because several systems here, respiratory and cardiovascular, are very closely related. I really hope that the flow of blood through the heart helps you understand how important normal anatomy is and how when those things go wrong, we can get some kind of pathology that can, in this case, be life-threatening. Thanks for listening. See you on the next one.